If you really want to know how well your body is aging, don't start with the mirror or the scale. Start with your legs. Your legs are one of the most honest report cards of your heart, your blood vessels, your nerves, and your brain, and they start giving you warnings years before a major event shows up on a scan or in the emergency room. Why your legs are a longevity lab. From a medical perspective, your legs are the perfect stress test for the entire system.
They sit far from the heart, so they're the first to suffer when circulation is compromised, when nerves are damaged, or when muscle mass quietly melts away with age. Think about what your legs have to do every single day. Support your full body weight, stabilize you when you lose balance, push blood and lymph back to the heart against gravity, react to the ground in milliseconds to prevent a fall. Because of that workload, small problems in your metabolism, arteries, veins, or nerves often show up in the legs before they become obvious anywhere else.
Clinically, that's why leg symptoms in older adults are rarely just a leg thing. They're often a window into cardiovascular risk, metabolic disease, frailty, and even brain aging. In this video, the goal is simple. Decode the main warning signs your legs may be giving you. Explain what they usually mean physiologically. Show you how to build leg reserve so you can age with more strength, independence, and margin for error.
The 5 systems that make or break your legs. To keep it structured, think of your legs as a coordination of 5 main systems: nerves, sensation, control, reflexes; arteries, oxygen and nutrient delivery; veins and lymph, fluid return and pressure control; muscle, force, power, and metabolic reserve; movement skill, balance, coordination, and agility. When your legs fail first, it's almost always a problem in one or more of those systems. Let's walk through each one in detail. 1. Nerves. When your feet go quiet or loud. The first system is your nervous system.
In practical terms, that usually means the long nerves that run from your spinal cord down through your legs all the way to your toes. Many people first notice trouble at the bottom of the feet. Numbness, burning, electric pain, pins and needles, a cotton or thick sock feeling even when barefoot. These are typical descriptions when distal nerves start to suffer. Metabolic conditions like diabetes and prediabetes are among the most common medical associations.
Chronically elevated blood sugar and related metabolic stress can damage both small blood vessels that feed the nerves and the nerves themselves, especially the longest ones in the body. Why does this matter for longevity and not just for comfort? Because once sensation is impaired, several things happen at once. Balance becomes less reliable, especially in the dark or on uneven ground. Micro-injuries to the feet may go unnoticed and untreated. Gait patterns change, which can overload joints and muscles elsewhere. For an older adult, that combination increases fall risk dramatically.
And a single fall with a hip fracture, head injury, or long hospitalization can mark a turning point in long-term independence. So if your feet are talking to you or going quiet, take that seriously. Do not assume it's just aging or bad circulation. It's a signal that deserves objective evaluation by a clinician, including metabolic screening and a focused neurologic exam. The earlier a metabolic problem is addressed, the better chance you have of slowing or stabilizing nerve damage and protecting function.
2. Arteries. Pain when you walk, relief when you stop. The next big player is your arterial system. Healthy leg arteries are like flexible, responsive highways delivering oxygen and nutrients to working muscles. With age, genetics, smoking, high blood pressure, and metabolic disease, those arteries can stiffen and narrow.
One classic leg warning pattern is called claudication type pain, cramping, tightness, or fatigue in the calves or thighs, triggered by walking a predictable distance, relieved within minutes of rest. People often describe it as a Charlie horse feeling that forces them to stop. The key is this reproducible cycle. Walk, pain builds. Stop, pain fades. That pattern is a clue that the supply of blood during exertion is limited and the muscle is protesting. From a longevity standpoint, why is this so important? Because peripheral artery disease in the legs almost never lives in isolation.
If leg arteries are narrowed or diseased, there is a higher probability of arterial disease in other critical territories like the heart and the brain. In other words, your walking pain is not just about your calf.
It's information about your global vascular health. Ignoring this type of pain is risky. Trying to push through with no evaluation can be dangerous in some contexts.
The right next step is not a random internet stretching routine. It's a medical assessment that may include simple, non-invasive tests like comparing blood pressure at the ankle and the arm, along with cardiovascular risk evaluation. Once serious pathology is ruled out or managed, structured walking programs and progressive leg conditioning can become part of the treatment, not the enemy. The key is, don't self-diagnose. Let a professional determine whether the issue is purely deconditioning, vascular, neurologic, or a combination.
Veins and fluid, heavy ankles, tight socks, and skin changes. Most people focus on arteries, but the venous side of the circulation is just as critical for leg health. Your leg veins have to send blood back uphill, against gravity, all day long. Tiny valves inside those veins help prevent backflow, and the calf muscles act like a powerful mechanical pump when you walk.
When this system struggles, several things show up visually. Persistent swelling around the ankles, a feeling of heaviness or tightness by the end of the day, indentations in the skin from socks or shoes, skin color changes, especially brownish or reddish patches, visible varicose veins in some individuals. This is not just a cosmetic issue. Chronic venous insufficiency can gradually damage skin and soft tissues, making them more fragile and less able to heal. In later stages, people may develop venous ulcers that are notoriously slow and difficult to treat.
Prolonged fluid overload in the lower legs can also be influenced by heart, kidney, or liver issues, so it's not something to treat with a cream without understanding why it's happening. There is another venous problem that is more acute and dangerous: deep vein thrombosis. One-sided leg swelling, redness, warmth, and pain, especially following long travel, surgery, or a period of immobilization, should immediately raise the suspicion of a clot. That is an emergency evaluation situation, because if a clot travels from the leg to the lungs, it can become life-threatening.
For long-term leg health, the take-home message is simple but powerful. Your veins love movement. Every step you take activates that calf muscle pump, squeezing venous blood upward, supporting lymphatic drainage, and reducing pooling. Prolonged sitting with zero movement, day after day, is essentially putting your venous system in slow motion. 4. Muscle, sarcopenia, strength, and the reserve tank. Now we arrive at the engine of the leg, skeletal muscle. Muscle tissue is not just for aesthetics, performance, or sports. It's one of the most important longevity organs you have.
With age, most people gradually lose muscle mass and strength if they are not actively fighting that process. This age-related decline is called sarcopenia. It usually starts quietly. Carrying groceries feels harder. Climbing stairs leaves you more out of breath. Standing up from a low chair requires your hands. Eventually, it can progress into difficulty getting out of bed, off the toilet, or up from the floor without assistance. At that stage, functional independence is at real risk. Why do clinicians care so much about sarcopenia and leg strength?
Because muscle is your functional reserve tank. When you get sick, when you're hospitalized, when you're bedbound for a few days or weeks, your body often breaks down muscle to meet energy and protein demands. If you start with very little muscle, you have very little margin. Multiple studies have shown that low muscle mass and low strength in older adults are associated with higher rates of disability, slower recovery, and higher mortality. On the other hand, better strength is frequently linked to lower all-cause mortality, even when you adjust for other risk factors.
Lower body strength and power in particular are critical for catching yourself when you trip, getting up after a fall, and generating enough force to move your own body weight. And muscle is not just mechanical, it's metabolically active. It helps regulate glucose and insulin dynamics, store and use fuel, support basal metabolic rate, buffer against insulin resistance and metabolic syndrome. So when you invest in leg strength, you're not just training a movement, you're training a metabolic organ that talks to the rest of your body through hormones, myokines, and fuel handling.
5. Movement skill, balance, agility, and the brain-leg connection. The last system is movement skill, how your brain, inner ear, eyes, joints, and muscles coordinate in real time.
Two people can have similar leg strength on paper, but very different risk profiles because one has poor balance and slow reaction times. Simple daily tasks tell you a lot. Can you stand on one leg for at least a few seconds without grabbing a support? Can you change direction quickly when walking without feeling unsteady? Can you step over an obstacle without shuffling or freezing?
These details sound small, but for an older adult, they can be the difference between catching yourself and hitting the floor. Falls are a major driver of fractures, hospitalizations, head injuries, and long-term care placement. Once someone is afraid to move, they move less. That accelerates muscle loss, cardiovascular deconditioning, and social isolation. It becomes a vicious cycle. This is why clinicians and physical therapists focus not only on how strong are your legs, but also how do you use them in real life. Can you rise from a chair repeatedly?
Can you sit down and stand up from the floor? Do you need your hands, or can your legs and core handle it? One of the simple functional screens that has drawn attention is the sitting rising test, going down to the floor and coming up with the least support possible. It blends leg strength, hip and ankle mobility, core control, and balance into a single quick task. Lower scores on this type of test have been associated with higher mortality risk over time, which tells you something important. How you move is not just a convenience metric, it can be a survival marker.
Of course, not everyone should attempt a floor-based test without supervision, especially those with osteoporosis, severe arthritis, or high fall risk. But the principle stands. Maintaining the ability to get up off the floor, out of a low chair, and upstairs without assistance is one of the most important movement assets you can protect with age. From warning signs to action, what you can do this month. Now that you understand the 5 systems, how do you translate that into an actual plan?
Here is a medically sensible starting framework you can adapt with your own healthcare provider. Step 1. Respect the red flags. Do not out-tough these symptoms. New or rapidly worsening numbness, burning, or loss of sensation in the feet. Calf pain that reliably appears with walking and disappears with rest. New, one-sided swelling, redness, or warmth in a leg. Sudden weakness, trouble moving a leg, or inability to bear weight. Non-healing wounds on the feet or ankles. These are not gym questions, they are medical questions. The correct move is evaluation, not a new pair of compression socks bought online. Step 2. Build a leg strength baseline. If you're medically cleared for exercise, focus on 3 foundational strength patterns for the lower body. A squat pattern, sitting down and standing up from a chair, gradually lowering the height over time. A hinge pattern, bending at the hips with a straight back, like a deadlift or hip hinge, to strengthen glutes and hamstrings. A step pattern, stepping up onto a low step or stair under control, eventually progressing height or load. You do not need complicated equipment to start. Body weight, a sturdy chair, a low step, and possibly a light dumbbell are enough for many beginners. The goal is progressive overload over months and years, not a 3-day transformation. Step 3. Train the calf pump and venous system. Because your veins depend so much on the calf muscle pump, make calf activity a daily habit. Regular walking throughout the day, not just a single long walk. Periodic calf raises if you sit for long periods. Short movement breaks on flights, long drives, or desk-bound workdays. Think of it as brushing your legs circulation. Small, frequent hygiene sessions, rather than occasional heroic efforts.
Step 4. Preserve and practice movement skills. At least a few times per week, include tasks that challenge balance and coordination in a safe, controlled way. Sit to stand repetitions without using your hands, if safe. Slow, supported single leg stance, holding onto a counter at first if needed. Step overs, gently practicing stepping over a small object or line. If you're older or at high fall risk, work with a physical therapist or qualified clinician to design balance training.
The goal is not circus tricks. It's robust, repeatable skills that translate into safer walking, turning, and reacting in the real world. Step 5. Align your lifestyle with your leg goals. Finally, remember that your legs are deeply affected by what you do outside the gym. Nutrition influences your ability